Hello, I'm Dr. Nirad Vengsarkar. I'm attached to Lilavati Hospital. I'm a consultant orthopedic spine surgeon. Today we are going to talk about a condition called lumbar canal stenosis. Now, this is a very common condition and it usually happens to people as they get older. This is unlike a herniated disc or a slipped disc which generally affects a younger population. So, lumbar canal stenosis literally means a narrowing of the space of the lumbar canal. This is dependent on two things. One is how fast we undergo wear and tear, and secondly, depending on the size of the canal that we are born with. Now, what the symptoms of lumbar canal stenosis usually, as I said, affect the elderly people. It's usually above 60 and above, though there are some conditions in which people are born with narrow canals where the symptoms may come in earlier. So, the typical symptoms are difficulty, pain in the back with pain going down one or both the legs, aggravated on standing and walking. The patients actually feel better when they are sitting and sleeping. So, what they usually complain of is that initially they could walk say 4 kilometers and now they are not able to walk for more than a minute or two, and they feel the need to sit down. The elderly people usually start bending forward and they feel better in that position because that's the position in which the spinal canal opens up and allows them to walk more. Usually when you examine a patient, they usually don't have any weakness or numbness in their legs, and they appear absolutely normal on examination. That's because the nerve is only transiently pinched. It's not getting permanently, because the moment the nerve starts getting pinched and they sit down, the pressure on the nerve reduces. Treatment for lumbar canal stenosis initially includes medications. There are medications like gabapentin, pregabalin which help, and physiotherapy, which is basically a spinal flexion based program. That is, they need to do exercises to open up the spinal canal. Things like lying on the stomach and doing a reverse bend actually aggravate the condition. If this does not work, then another treatment option remains injections into the back, which are called epidurals. Here, a low dose of steroid is injected into the back, which helps reduce the inflammation of the nerve and improves the symptoms of the patient, in which they can stand and walk better. If this also fails, the next treatment becomes surgical. In surgery, the area which is narrowed down needs to be opened up. So, these surgeries are called decompression procedures, which includes laminotomies, laminectomies, in which the space, that's the narrowing of the spine, is opened up. Sometimes they are done alone by themselves, or sometimes they are accompanied by surgeries which include instrumentation, in which screws are inserted into the back. This depends if the patient's spine is stable or not. So, if the spine is stable, where there is no forward movement or backward movement on the spine, then only a decompression suffices. If there is an instrumentation required, that is done in cases of instabilities. Usually, this would give patients long-lasting relief. So, spinal canal stenosis is a very common condition affecting elderly people. It is seen more often than what you would anticipate seeing. The treatment, as I have laid out, is basically conservative first, followed by injections, followed by surgery. These are the progressive ways in which we treat it. The only indication for doing a surgery earlier would be if a patient has a neurological deficit. Thank you.